Hello, my name is Todd Chusid. I am a senior digital strategist with Anexinet. This short video will provide you with some initial insights and implications of the insurance plan in the context of your overall patient engagement strategy. In this video, we will highlight where can we expect to see the biggest changes in modern day insurance planning and the next steps to take to assist you on this journey. There's no denying that healthcare is an industry of exceptional standardization. With standardized protocols, standardized practices, and standardized procedures are all necessary components to ensuring efficient, high-quality care. But today's consumers have come to expect companies to know them, offer products based off of previous purchases, anticipate needs based on interactions with the company, and tailor messages specifically designed for them. Patients, who are also consumers, have come to expect this same level of personalization from their healthcare providers, coupled with that exceptional standardization from the healthcare industry. Yet, in the midst of all this personalization, many patients believe their insurance plans are not tailored to their needs. The type of patient they are, based upon the care that they require at a specific stage of their life. Patients don't want and can no longer afford a one size fits all approach with all those bells and whistles. Patients want to be in control of what services they want based upon how much they can afford, and it starts with greater transparency into insurance information to enable consumers to plan their financial responsibilities and determine their own insurance plan, also known as consumer driven health plan. So, what is a consumer driven healthcare plan? A CDHP is a high deductible plan where a portion of the healthcare services are paid for with pre tax dollars. These high deductible plans have higher annual deductibles and higher out of pocket expenses than your tailored health plans. The trade off? The insured pays lower premiums each month. But the general objective of CDHP is to get members to behave more like consumers by increasing their personal financial exposure to their healthcare costs. And when members enroll in CDHPs, they are more engaged in their own health. They have lower medical expenses, and they have ownership of their insurance plan. When participants are empowered, providers of CDHPs also see benefits, but the provider must offer the tools they require to keep them as a customer. A recent study showed that 50% of those CDHP participants are more likely to complete a health risk assessment. 75% of those CDHP participants will access their online patient portal or mobile app. 82% are more likely to use online tools to manage their health benefits. And finally, 62% of those CDHP respondents are more concerned about healthcare expenses over lifestyle expenses when it comes to retirement. So, where can we expect to see the biggest changes in insurance planning? Here are just 3 examples which leverage mobile and interactive tools in an effort to increase adoption of your CDHP and your consumer. First and foremost, let's provide Medicaid and Medicare analysis tools, which would then provide help to people to understand what's covered by original Medicare. For example, Part A for hospital and nursing home coverage, and Part B for doctors' outpatient expenses and durable medical equipment. By providing this type of analysis, it links directly back to the consumer wanting to understand their financial responsibilities. Second example, let's start to offer real-time advice and decisioning. By using an interactive tool to ask people specific questions about their health and insurance needs, we could then apply the health industry often complex rules to answer the questions and then produce an easily understood recommendation along with a proper narrative explaining reasons for our recommendation. By providing this type of advice and decision for the consumer, it clearly aligns with their objective of personalization versus a one-size-fits-all approach. And lastly, let's start linking enrollment with insurance planning and financial planning. It's not only important to educate and guide consumers to elect the right combination of plan and benefit based upon past spending behaviors and a future needs analysis, but at the same time, we have to start linking their healthcare cost to their retirement planning and saving strategies. This integration of insurance planning with financial planning, coupled with the cost of retirement, is probably one of the most important tools we need to start providing our consumers today. To ensure your organization makes the shift to deliver modern day insurance plans to your patients, here are some key next steps you should consider. First and foremost, since we are in a very dynamic industry, it's most important to reevaluate and update your patient digital strategy based upon the patient profiles, use cases, and metrics you will use to support these modern day insurance plans. With an updated digital patient strategy in place, you can begin to identify and develop technologies and online tools that will enable you to provide the best consumer experience, and which those tools also empowers those consumers. And finally, and because we always need to build trust through transparency, efficiency, and delivery of value, it's important to identify, analyze, and evaluate your data in order to deliver personalized, real-time, and most importantly, secure information. This concludes our video, and I want to thank you for watching. If your organization is just getting started or trying to figure out how to overcome the challenges and opportunities mentioned in this video, Annexonet's Healthcare Digital Solution Strategy Kickstart ensures success by accommodating these requirements with a comprehensive implementation approach. Working closely with your organization, we will rapidly bring to life a secure, next-generation digital patient engagement experience that leverages the latest technologies to provide users the information and interactions they need the moment they need them.